Hi, I'm Emma Sutherland, clinical naturopath, author, mum, and your host. With over 20 years in clinical practice, I've helped thousands of women and families transform their health using evidence based integrative strategies. Now, I am deeply passionate about making science simple and actionable so that you feel confident and empowered in your health decisions. So, this channel is your go to for trusted insights, expert conversations, and practical tools that support real life wellness. Now, in today's episode, we're diving into the world of teenage hormones, specifically a lesser known type of PCOS that often goes undetected. This one doesn't come with the typical signs like excess weight, acne, or hirsutism, making it more challenging to diagnose and support. Now, I'm thrilled to be joined by renowned naturopath Daniela Viola from LiveWell Natural Health Clinic. With over 20 years herself of clinical experience supporting women and teens with complex hormonal conditions, Daniela brings both deep clinical insight and a compassionate, practical approach to hormone health. Thank you so much for joining us today, Daniela.
Very welcome.
Now, can you start by explaining what is PCOS and how the lean or non classic form presents differently in teenagers?
Yeah, sure. So I guess polycystic ovarian syndrome is one of those things where GPs especially are looking for the whole syndrome M. So, and you know this as well, they're looking for someone who's overweight, has lots of acne, lots of hair growth all over their body, and irregular cycles or no cycle at all. And I guess in clinic and in your clinic, we don't see that. It's rare, really, to see the whole syndrome. So I think many girls get overlooked, especially if they don't fit that profile or they're a little bit not underweight, but normal weight range, might not have excessive hair growth, might have a little bit of acne. That's completely overlooked for them. So for me, I'm always looking at lots of different aspects of their cycle and their skin and their hormones and what they're kind of telling me to pick up a little bit of polycystic ovaries and not necessarily the syndrome. So I
Yeah.
think I that then the whole syndrome.
Yeah. And I think that's a good delineation is that we have this kind of type that we think PCOS is. And
Yeah.
like you, I've seen so many young teenagers that have just been told you have PCOS, where there's really not been the appropriate diagnostic criteria being met. And how often do you see this type of PCOS overlooked or misdiagnosed?
I think I see it probably it's one of the things I'm seeing the most at the moment. I see a lot of teenagers, but I think maybe 3 times a week I'll have someone that comes in and I'm thinking they're looking polycystic. And you almost don't want to say it because there's a negative connotation with that as well. And sometimes they're very surprised, or their parents are very surprised you've even mentioned it because it seems to be this thing where if you're diagnosed, you're given the pill to fix it, or there's a medication for it. Whereas those kind of subtle signs of an irregular cycle or some acne happening with it and not ovulating every month, that can be fixed with diet, exercise, and the whole syndrome can be avoided. And
Mm.
later on, other issues can be avoided, or hormonal issues can be avoided as well. So it's with PCOS, one of the easiest things to kind of fix in a young girl. It's one of the most common things to find in a young girl. And I was going to speak today also about why it's so prevalent in teenagers at the moment too, because I feel like I'm seeing more and more of it with young girls. And I think very much of it is dietary related, but also physical activity. There's a lack of physical activity at the moment because of social media and being on devices all the time. But that particular age group, I find exercise starts to diminish for them. And that becomes a bit of an issue too when you're looking at regulating hormones.
Such valid points. You mentioned a couple of the subtle early signs that parents and practitioners might miss in teen girls. There was irregular cycles, there was acne, or even just hormonal breakouts, which both of
Yeah.
those are extremely common. in this age group. Any other early signs that we should keep an eye out for?
So the first sign you want to look for, I guess, is if your child, if you're coming in as a parent that's concerned or listening to this as a parent that's concerned, if your child started having signs of puberty quite early on, so even 9 years, 10 years of age, and then didn't get a period for maybe, or they might be 14 or 16, still not have a period or have a very irregular cycle, then you're questioning it. Why hasn't my child, if they were showing signs of puberty early on, not have a period yet? Because that can also, even if they've never menstruated, be a sign there might be something going on for them with ovulation and possibly a little bit of polycystic ovaries, which is
Mhm.
related to a hormonal imbalance caused by a bit of insulin resistance. The other sign is irregular cycles. So it's not enough to just ask your daughter, or if it's a teenager listening at the moment, do you have a regular cycle? Because the answer that I get in clinic is, yeah, oh, she gets a period all the time. But what kind of regularity? So it might be a
Mhm.
34-day cycle for that child. It might be a 40-day cycle for that child. What I do know that if
Mhm.
it's over 32 days, there is a struggle there to ovulate. So
Mhm.
you're already at a little bit of a hormonal issue. And that's where I go to, okay, it might be a little bit polycystic. Let's try and address dietary stuff and exercise, obviously, and what nutritionals do we need to use for this person, but also looking at family history. So I know
Mhm.
always if you're looking at family history, there is a tendency for young girls, if there's type 2 diabetes in the family, to go on to develop insulin resistance early on. And sometimes you see it carried through a lifetime of that person. So it might be insulin resistance and PCOS young, gestational diabetes in pregnancy, insulin resistance in perimenopause, and then finally a type 2 diabetes diagnosis. And sometimes it's working back with a parent that's seeing me who hasn't brought in their child, and then that parent realizing, oh, I probably did have some form of insulin resistance as a teenager, and that's why we've ended up here. So there's usually, and the biggest thing about type 2 diabetes is patients saying to me, oh, but that's just because they ate badly. It is and it isn't. Like, it definitely is and it can be avoided, but there's a genetic pool there as well. So that's why I'm always asking, is that in the family? Especially if the teenager's presenting with something slightly polycystic in nature.
Okay. And then what are the actual hormonal imbalances that drive this particular form of PCOS?
So I think the biggest thing that GPs are looking for, so often teenagers come to me and they might have already had a hormone done or a blood done with a GP, and all that's ever been checked is androgen, so male hormones, testosterone. Now, rarely is that ever going to give you the answer, and rarely is it going to be elevated. You need to kind of look at the picture as a whole and all of their hormones at the time. So, the biggest driver, I guess, for an ovulation happening late and no period or a late period would be insulin is a hormone that we're always checking. I also check cortisol. And I guess the misconception is if you're a good weight or a normal weight, you're not going to have issues with insulin. You're not going to have issues with sugars, and that there's not going to be a problem there with polycystic ovaries. And that is incorrect, completely incorrect. But cortisol is another hormone, a stress hormone. And you've seen these young girls, anxiety and stress is huge. And that will drive the insulin to be high in those girls as well. And you might see that on a fasting insulin, but we know it's there if they're not ovulating. There is a hormonal imbalance there, and sometimes you just can't see it. Those day 2 hormones are really important too, looking at the pituitary and what it's doing there on day 2. So all of the hormones together, including estrogen, is important. It's not all about testosterone levels. And sometimes if I can't see it, I even check something called an AMH just to see if it's falsely elevated for that teenager, because sometimes that's the only thing that tells me, yes, there's too many follicles sitting on those ovaries. It could be a little bit of polycystic ovarian syndrome. And that's not a hormone you
Mhm.
often check in teenagers, but it can be the only hormone that you can find that one little sign that there's an issue there that's leading to possible polycystic ovary picture. And I guess doing an ultrasound sometimes with the GPs, so sometimes they'll send you for an ultrasound. I'll always send you for an ultrasound if your teenager isn't ovulating or having a regular cycle. They're looking for a very polycystic looking ovary. So that doesn't
Mhm.
mean a cysts on that ovary, that means too many follicles on the ovary, but they're actually looking for a number and they're looking for 25 plus follicles. Now,
Mm.
you and I know, even 18 follicles on an ovary, there's an issue there. That teenager is struggling with ovulation. So, yes, our ranges vary greatly to what a GP would necessarily classify as an issue there for polycystic ovaries.
And I think that's a really good point. What we're looking for is a health range rather than what does sick look like on a blood test. So our ranges will be a little bit more refined. So when you're
Right.
looking at testing, we're looking at insulin, cortisol, day two hormones, not
Yeah,
just the androgens, and then possibly AMH and a pelvic ultrasound as well.
absolutely.
Yeah. Okay. And then when you're thinking about treatment things, there's so much that can be done for these girls, which I love. Our toolkits are really big in this space. But what are your preferences or go to strategies for regulating cycles and then really supporting ovulation? Because we know if we can get ovulation happening regularly, everything will fall into line.
Perfect. That's right. And so I think first I start very simple. You're looking at diet. And that's what I was saying with these young girls. It's when everything changes for them, their teenage years. So they will start to go out with their friends. They'll start to eat different foods because they're out and about. So they might start having heavy carbohydrate meals or fast foods and high sugary kind of meals. And all those kind of foods really affect hormones at that age where
Mhm.
you're trying to set that ovulation in so that you're having a nice regular cycle. So the first thing I'd start with would be diet and explaining what some of those foods are loaded with that they might not be aware of. I think the biggest thing at the moment is those acai bowls that
Oh,
us love to go out for. And some of them have up to 40 grams of sugar in them. So explaining that to, and I find teenagers are very receptive. Like once you've spoken to them about this is how much sugar a banana has in it, this is how much sugar an acai bowl has in it, then they start to realize and explaining to them if we spike sugars and insulin, then that's going to delay ovulation for you and change your hormonal balance. So just explaining to them that they need a really high protein diet, loads of vegetables in there, to be eating nice regular meals because teenagers love to skip meals and then like to binge eat, obviously, on the wrong kind of food sometimes. So that really impacts. I also see another hormonal shift around 18 where they might start drinking some alcohol and going out a little bit. Sometimes PCOS kicks in a lot then. And again, it's a diet. So always I focus on diet and lifestyle. So with these teenage girls, like I was saying, exercise starts to deplete, you find. So as they get older and they're focusing on study, which is stress as well, and we know that increases cortisol, but they're not doing that physical activity anymore. And even if they're lean, not doing physical activity means less regulation of sugars, okay, and less muscle mass. So again, it becomes hormonal. So you're not regulating hormones properly. So I'm trying to get those girls out, even if they're doing a bit of reformer Pilates or a light weights class, nothing too like cardio, but try and get them to balance out with some strength work. And then if I need to bring some supplements and herbals into it, I would as well, so that we can try and balance things and get ovulation happening for them. And you treat people as they come in and what they're needed at the time. Not everyone gets treated the same. Whereas if you did go to a GP, I guess the blanket approach is the pill because you are going to get a bleed every month if you take the pill. And that's purely because it's stopping ovulation altogether. Um,
Yes. And let's just break that myth that the pill regulates your cycle because it absolutely does not. It
oh,
shuts your hormones down, it flatlines your hormones. And one thing that I'm always saying to girls in this age group is you're really just uh, pressing stop on a hormone dysregulation that's going to come back when you stop the pill. And as we know, the pill depletes us of specific nutrients. It has many other effects on our body. So this is a big education piece for practitioners like you and I that we're constantly actually educating the parents about as well on that side of things. So give me your feedback on between the pill and then between metformin, which I also see so blanketly prescribed for girls in this age group. How do you counsel patients around these two options?
I guess the biggest thing is when they're young too, you want the least amount of intervention. That's something
Mm.
they can do later if they need to. Band-aiding the situation with the pill at that young age, really, like you said, you're switching the pituitary off. So
Mm.
there's no ovulation, and there's no ovulation if that teenager decides to stay on the pill for up to 10 years sometimes
Mm.
or longer. There is those ovaries haven't worked for that amount of time. So to switch on again at that later age,
Mm.
it will always be some sort of issue. And you're just having PCOS come back if that was the issue to begin with. It also hasn't dealt with the main issue, which is insulin resistance.
Mm.
So that's still going on in the background, causing a whole lot of other issues. So I guess that's what I say to parents. The other thing too is once you're on the pill, there's no way of diagnosing anything. We can't
Mm.
tell how the ovaries are working. We can't do an ultrasound because it doesn't mean any. The number of times girls have come in with an ultrasound done on the pill and
Mm.
it shows not polycystic
Mm.
is amazing. Like it blows my mind, Em, that
Me too.
Dolly prescribing metformin as well, a diabetes medication. Fantastic if a woman is trying to fall pregnant. We can't get them ovulating with everything that we've done. But as a teenager, there are so many other things in our talk here, but also diet and lifestyle wise that you can. And I always say PCOS, insulin resistance, and type 2 diabetes are totally treatable with diet and lifestyle if you get to them early. So you just really want to fix that problem so it doesn't lead on
Mhm.
to other things. But I guess exactly the same place you do with all of that kind of stuff. But you do see the pill, and I think a lot of mums and teenagers want to go to that gynecologist to get that expert opinion, and they're disappointed sometimes because that opinion often is the pill that or
Yeah.
metformin, no other kind of let's try this instead.
And I
Uh,
think that's the limitations at this stage in time. They're the limitations of what's available from that traditional medical aspect. It's a very limited toolkit, and it is really just the pill or you know, nothing or metformin. And I think that your emphasis on diet and lifestyle is so fundamental on that front. And nothing, not even a herb can act like a magic pill if we're not addressing those diet and lifestyle aspects that you mentioned, which I think is great. And the other thing that struck me when you were talking was just that trajectory of what if you don't treat the underlying hormonal dysregulation at a young age? And then it just keeps getting bigger and bigger. As you said, gestational diabetes in pregnancy, insulin resistance, perimenopause, and then we've got full blown diabetes by the age of 55. We can absolutely halt that all in its tracks by working on the hormonal health of these young women. That's a huge change on somebody's life.
yeah, absolutely. And I think insulin's one of those bloods that isn't seen as a hormone, and I think it
Yeah.
needs to be checked more often. And there's other tests for insulin too. There's HOMA tests that you can do. There's glucose tolerance tests that you can do. And I guess the traditional glucose tolerance test doesn't actually test insulin. And that's the
Right.
biggest issue with the testing is that it's checking your glucose at those 3 points instead of checking insulin as well. So
Mhm.
often back and their sugars are normal, but no one bothered to check their insulin levels. And it always starts with insulin being abnormal when you're looking at an issue with sugars to begin with. And I always say to my patients too, and like the insulin resistance can precede type 2 diabetes for 20, 30 years.
Yeah.
Uh, Catch it early, there's so much you can do, but it's also something that may be genetic with you that you need to work on for the rest of your life. I know that's the case with myself, who's got type 2 diabetes in my family. I was polycystic when I was pregnant and got an ultrasound done. I always suspected it, but I didn't have someone to tell me. So there's all that kind of stuff that gets missed. I guess I was always a normal weight range, didn't have acne. There was no kind of sign besides my 40-day cycles and the history of type 2 diabetes in my family that said I could possibly be polycystic.
It's really interesting, isn't it? You have walked this yourself. You know what to look for. And this is why you're so good at treating this particular hormone dysfunction. And then talking about just going back to the testing, I use a glucose tolerance test a lot with my patients. And it bothers me how often a patient will come in and say, oh, my glucose is fine or my insulin's fine, but insulin's never actually been checked. But I find that the glucose tolerance test is such a great functional test to show us what happens. Somebody's fasting and then they consume a huge amount of glucose, like a challenge test, a provocative test, and then to see how their levels go after that 1 and then 2 hours. I find it really insightful. And to do this test privately, it's about $66. It's not that cost prohibitive. And I do utilize it a lot in clinic for the amount of insight that it gives and directs treatment as well.
And it also convincing that person that there is a problem sometimes when they're not thinking that there is a problem. And I mean, we're talking about teenagers, but it's obviously mums will be listening to this. And I know with my mum, when I went back, when I was first diagnosed with polycystic ovaries, I went back and asked her what her cycles were like. And now she's got type 2 diabetes. And she also had gestational diabetes. And I asked her what her cycles were like. And she said, no, they were regular, but her regularity was like what I was talking about. They were about 40 days. So it took her nearly 12 months to fall pregnant. So again, it's the reason, obviously, you and I are concerned for teenagers and a teenager isn't so concerned is that later on it does impact. And those teenagers with PCOS or showing signs of PCOS, you have got a high risk of gestational diabetes.
Mm.
And I guess the other thing they don't test in pregnancy is insulin. So they'll do that ketose test and they're not checking insulin. Again, it's a really big miss there on the part of mainstream medical not checking insulin levels. And I'll have GPs ask me all the time, why do you want that? So there's non-recognition of insulin resistance being associated with polycystic ovaries as well. It's always an androgen issue. And it's not always,
Yes.
I mean, the testosterone gets elevated because of the insulin being elevated, that they're not working backwards like that. So that's where if you get a nice young teenager, they're fresh and you can do so much to avoid all of that happening for them.
And these are definitely, when I think about a lot of another demographic that I work a lot with, which is that perimenopause, menopause. And these are also the women that tend to put on 10 plus kilos in that peri to menopause phase. They put on a significant, more than average amount of weight. And when you track it back, you can see all the flags were there, but they were never put together like this.
Yep.
So this is where we can, as naturopaths, really jump in on that proactive health approach, which is brilliant.
Yeah, absolutely. And that's why a lot of mums will end up bringing their daughters in because they realize that is actually going on. And so I think the number one thing too with your girls, if you're listening to this as a mum or if you're listening to this as a teenager, is to get a period tracking app because that will tell you. And there is a section, a lot of girls will come in and they don't realize there's a section in there that tells you your cycle length. And a lot of girls also don't realize their cycle length is the first day of bleed to the next. And that should be 28 to 30 days, maybe 32 days max. But when you see it going over that regularly, or you see it jumping around or skipping months, then there may be an issue there. So I think that's say to girls is get yourself an app. Let's track it because you're saying you kind of get it every month, but what does that actually mean?
Yeah, absolutely. I really like the app Flow. You just need the free one. They try and bump you up to a subscription constantly, but you only need the free one and it gives you graphs and reports in that free version. Great idea and recommendation to start tracking regularly so you actually know the reality of the situation on that front. Now, when we think about this situation, emotional well-being can really take a hit with unpredictable cycles or confusing symptoms. How do we support the mental and emotional side of things for
Yeah, and
teenagers?
the big one is there is an irregular cycle, because you find that whole premenstrual period it's not distinct. Often when you're
Mm.
getting a nice period, you might get with a teenager a couple of days before where they might be a bit moody or they have a breakout. Whereas when it's an irregular cycle, because of that hormonal imbalance or that extended period of not having a period, that premenstrual time is a lot and a lot longer. So moods are all over the place as they're trying to ovulate. They might find acne around that time too. So I guess I always speak to the parents as well, getting them to do things to relax themselves, meditations, but sleep is really important. And that's one thing that teenagers don't get a lot of. And they do like to stay up on their phones a lot. So the sleep helps regulate your hormones. So getting them to get a schedule there with their sleep is really important. We all know when we're looking at too at insulin resistance and type 2 diabetes later on, sleep is implicated in that as well. So the less sleep you get, higher insulin levels. So sleep's really important. That kind of downtime for them, relaxation, getting on top of schoolwork and not being too anxious to raise cortisol levels is really important. So I use a lot of nervine herbs with them in clinic and try to focus on that a lot too. And sometimes that's all I'll do at the first appointment. If I'm suspecting that stress and premenstrual hormonal kind of stuff's happening, we just focus on mood and nervous system to try to regulate that. And sleep's the biggest thing I'm finding with teenagers at the moment. They're not getting enough of it. And sometimes it's their fault because they just don't want to go to bed and they're on their phone a lot. So getting them to regulate that and knowing how sleep is for them and their hormones is really important as well.
Yeah, sleep is a massive one for teenagers. And to some degree, they do need the education and empowerment so that it is self-directed, because there's only so much a parent can often say to a teenager. Often parents say to me, gosh, I'm in bed before my teenager. So it's also our job to tell them and explain to them how important that sleep is so that they can become a little bit more self-directed on that front. What advice would you give to mums who suspect that something may not be right with their cycle, but they just don't know kind of where to start?
So that's where I would say definitely get your teen to start tracking or track it for them. So you could start off there. Is the cycle regular? And when I say regular, like I was saying, 28, 32 max days is what you're kind of looking at. And then maybe seek a naturopath or a nutritionist for extra help. You can definitely go to a GP, but sometimes I find you're a little bit limited. They're not sure where to look for hormones, what day to test hormones on.
Yeah.
Sometimes your naturopath is always going to send you to a GP to get everything done anyway and get a review. I mean, I use GPs all the time and I'm always looking at blood work. So we're always going to send you there. Sometimes it's good to use this a bit at the beginning so that we can tell you what to get checked. Because once you've had those bloods done, you come into our rooms. I find sometimes where it's missing a whole lot of stuff that I would have wanted to see. And then to put that
Yeah.
teenage blood work again, they're not going to like it. We know that, Em. So sometimes it is start with a nutritionist or a naturopath and get them looked at and then get bloods done from there so that we get all the right blood work done for them, especially if it's not cut and dry kind of hormonal stuff. And also, I always say this to parents, okay, so we've picked up polycystic ovaries, but you're still suspecting there's something else going on for that teen because they're getting very painful periods or really heavy bleeds, which isn't necessarily a PCOS thing. There could be other things going on as well. It's not just one hormonal issue. And sometimes that's where you get pigeonholed. I go, you've got that. Sometimes it's an array of different things. So yeah, starting off with path and then sending on for further testing. We kind of know what we want to get tested so that it's kind of inclusive of every hormone and ultrasound, all of that kind of stuff.
Yeah, I can't tell you how many times young teenagers come into clinic and the mum brings them and they give me the blood work and they've done, it happens so frequently, it blows my mind. They've done hormones, but they were never told you need to do these hormonal baseline tests done on the second or third day of your cycle. So not only have they wasted Medicare and looking at that side of things, but the bloods are literally, those hormones are completely, I cannot use them from a treatment perspective. So I think it's a really great point to see a naturopath or nutritionist that's got really good experience in the space of hormones, and then to then be advised which bloods would actually be clinically relevant to do. Fasting, insulin, day 2, day 3 hormones for me are the big ones that I want to see. And Yes, of course, we can do private bloods, but at the same time, we don't want to send people for more blood draws than really necessary. So I think that's a really valid point. And tracking those cycles. And as a mum myself, if you carefully watch your teenager just quietly on the side, you can start observing those sort of cyclical patterns in their behavior. So you can even start collecting a little symptom diary of what you're observing as well that
Yeah,
might just be really helpful from that third party perspective.
absolutely. You can always pick up when they're about to have their period anyway. Uh,
Yeah.
does get trickier when they've got an irregular cycle because you're like, oh, she seems really premenstrual. Why isn't she getting her period? So that's another sign something might be going on. Yeah, just looking at them and taking in that information is really important.
I love that. And then are there any myths that you want to bust or last thoughts for us?
Look, I just think take notice of your teenager, and especially with hormonal stuff and their cycle, and don't be scared of it. I find that parents, if I start talking about, and that's why I often don't call it polycystic because it's a little bit of a freak out on their part. It's at that age, really, you just want to start balancing stuff out for them. You're really helping them. You're being very proactive about it. So I think that's the biggest myth. Don't see naturopath because you think they're going to tell you something's wrong. They're there to help you and really help the child balance things out. It makes a whole lot of things easier for the teenager as well, because when they're hormonal all the time, or they're feeling not quite right, or they don't know when they're going to have a bleed, which can be very uncomfortable for them. And they might be wearing a pad every day to school because they're just unsure when their period's going to come. A lot of that stuff can be explained to them and you can kind of balance things out for them. The biggest myth is don't be scared of coming in and having a consultation or think that you're overreacting in any way because you're not.
Mm.
I mean, for dietary stuff for that teenager. So I think that's probably the most important thing to take away from all of this.
I really love that reframe of we just want to support really healthy, regular ovulation. That's the goal. At the end of the day, with anyone's hormones that's in that cyclical phase, is optimizing and supporting a healthy, strong ovulation is so important for so many reasons. But yeah, it's an important reframe. I love that.
Absolutely. And I think the girls get more out of it too. Once you bring them in, they might not want to be there, but once you start speaking to them, they're like, yeah, I'm cool with this. And then they will surprise you. They will surprise you. Yeah.
Yeah. Yeah. I actually love working with teenagers because we see them differently to how their parents see them. And I often say to the teenager, this is your protocol to do. You've got this. You know how to do this. I'm explaining it to you. It's not up to mum to nag you. You've got this. And then mum will often email me 2 or 3 weeks later and go, she surprised me. She's actually doing it. And I'm like, of course she is, because she's totally capable, right? She's totally capable. And teenagers like being empowered.
Yeah, it does make them take control of their own health. And you get them cooking things and you're
Mm.
thinking, I'm never going to pick up anything in the kitchen. And all of a sudden they're beer puddings. And it's someone else telling them what to do instead of your
Mm.
mum. So I think that it is great seeing teenagers and the way they react to all of this. And I think it's in the media more natural health kind of stuff now. So they're into it. They see it on TikTok. They already know a lot about a lot of stuff that sometimes their mums don't know about.
Yeah.
It is
Yeah.
to be teenagers. I love it.
Yeah. Fantastic. So if people want to reach out to you, where can they find you?
Oh, look, you can easily find me on the internet. I have a website, livewellnaturalhealth.com.au. You can make an online booking or give me a call. I'm in clinic most days.
Beautiful. Thank you so much for your time today, Daniela.
It's always lovely chatting to you.
Thank you for being with me today. Don't forget to like this video and hit the subscribe button below. Check out the links for the show notes on more health empowering information. And please feel free to ask me any questions in the comments below.